everyone, welcome back to our next Adult Nursing 1 presentation. Today my group will be discussing on prolapse mitral valve replacement. My group members include Chevanice Fagan, Anika Goodwin, Kiona Oxford, Melissa Mary, Janelle Gordon, Gabriella Brown, and also Francine Hunter.
Mitral valve prolapse occurs when the flaps or the leaflets of the heart's mitral valve bulge prolapse like a parachute into the heart's left upper chamber, the left atrium, as the heart contracts.
Possible assessment findings for prolapsed mitral valve. A mid-systolic click. A mid-systolic click is a high-pitched sound which is a defining auscultatory feature of prolapsed mitral valve. It occurs when the mitral valve apparatus tenses suddenly when the leaflets prolapse into the left atrium during systole. As different sections of the mitral leaflets prolapse at different periods during systole, multiple clicks can be heard. The volume and contractility of the left ventricle influence the loudness and timing of the clicks. The clicks are usually followed by a mid or late systolic murmur. However, this is not always the case. The length of the murmur is usually proportional to the severity of the mitral regurgitation. Shortness of breath, tiredness, or lightheadedness. When there is a more severe mitral valve regurgitation, symptoms of shortness of breath, tiredness, and lightheadedness may occur. Possible assessment findings for
Heart palpitation. Premature ventricular contractions are the most common cause of heart palpitations, but supraventricular rhythms have also been discovered. Palpitations may occur in some patients despite the absence of dysrhythmia. By Johns Hopkins 2021.
Orthostatic hypotension. Orthostatic hypotension is a condition in which your blood pressure falls significantly when you stand up quickly. The physiopathological mechanisms of this symptom is not clearly known, but multifactorial causes are thought to be responsible, including autonomic dysfunction, hyperadrenergic state, abnormalities in regulation of baroreceptors, parasympathetic derangements, decrease of intravascular volume, abnormal renin-aldosterone response to depletion of intravascular volume, and abnormal release of atrial natriuretic factor. Fatigue. People with mitral valve prolapse may have imbalances in their autonomic nervous system, which regulates heart rate and breathing. These imbalances may cause inadequate blood oxygen delivery to the entire body. If the blood flow to large muscles of the body is restricted, there may be a buildup of a chemical called lactic acid. This lactic acid accumulates because the large muscles are not getting sufficient oxygen or nourishment, which may also contribute to burning feeling in the muscles. Therefore, fatigue may be a result of a higher than normal production of lactic acid. What is valve replacement surgery? An open mitral valve replacement is a surgery to replace a poorly working mitral valve with an artificial valve. The mitral valve is one of the heart's 4 valves. It helps blood flow through the heart and out of the body. The mitral valve lies between the left atrium and the left ventricle.
Procedure and nursing care. What happens before a mitral valve replacement surgery? Before the procedure begins, the patient will receive general anesthesia, which will allow the patient to sleep and be free from pain during surgery. The patient will also be connected to a cardiopulmonary bypass machine or CBP, which keeps the blood moving throughout the patient's body during the procedure. Did you know that the night before surgery, a patient is not allowed to eat or correct. Would you like to know what happens during a mitral valve replacement surgery? So during a mitral valve replacement surgery, the heart surgeon removes the defective valve and replaces it with a mechanical valve or biological tissue valve. The mechanical valve is man-made and is made of materials such as titanium and carbon. These valves last the longest. However, you will be required to take blood thinning medicines such as warfarin for the rest of your life. As for the biological tissue valve, it is made of human or animal tissues such as cow or pig. These valves generally last for 10 to 15 years or longer, but you will not be required to take blood. What happens during a minimally invasive mitral valve surgery? During this surgery, the cardiac surgeon may take a 2 to 3 inch long cut in the right part of your chest near the sternum. The muscles in the area will be divided, which allows the surgeon to reach the heart. A small cut is made in the left side of your heart so the surgeon can repair. Are there any other procedures, you may ask? Yes, there is. Another procedure is endoscopic surgery. The surgeon makes 1 to 4 small holes in your heart. The surgery is done through the cuts using small camera and special surgical tools. For robotically assisted valve surgery, the surgeon may make 2 to 4 tiny cuts in your chest. The cuts are about ½ inch to ¼ inch each. The surgeon uses a special computer to control robotic arms during the surgery. A 3D view of the heart and mitral valve are displayed on a computer in the upper. Are you curious about what happens after a mitral valve surgery? So after mitral valve replacement surgery, the patient should expect to spend 3 to 5 days in the hospital after surgery. They will wake up in the intensive care unit and recover there for about 1 to 2 days. Nurses will closely monitor vital signs such as temperature, respiratory rate, and pulse rate. 2 to 3 tubes will be placed in your chest to drain fluid from around your heart. They are usually removed 1 to 3 days after the surgery. The patient may have a catheter in the bladder to drain urine and IV lines to deliver fluid and electrolytes. The patient will leave the ICU to a regular hospital room. Their heart and vital signs will be closely monitored until they are safe to go home. They will receive pain medicine for the pain in their chest. What will the nurse do? The nurse will help to start activity slowly. She will encourage breathing exercises, which helps to remove fluid that was collected in your lungs. The nurse will also educate the patient and family about how to care for incision sites and about signs and symptoms of infection and how the medications are supposed to be taken. A pacemaker may be placed in your heart if your heart rate becomes too slow after the surgery. This may be temporary or
Important teachings for a patient after valve replacement surgery. For the first 4 to 6 weeks, patients tend to feel tired and sore after surgery, and it may take 1 to 2 months to get back to their normal activity level. Avoid activities that may strain the chest or upper arms like mopping the floor or carrying heavy shopping bags. Depending on the job, it is advised that one takes 4 to 12 weeks off. Patients should practice deep breathing exercises to prevent pneumonia. The patient should be able to shower as usual. However, it is advised that they shouldn't take baths or swim for at least 3 weeks until the doctor says it's okay. Additionally, one should ask the doctor if it is okay before driving or having sex. Exercise. Avoid any kind of strenuous activities like jogging, weightlifting, or bicycle riding. Patients are advised to walk every day, starting with small distances, then gradually increasing each day to promote circulation. However, it is advised that they should rest whenever they feel tired. Travel. Talk to your doctor if you're considering to travel, as certain places are more prone to bacteria. Follow up. Follow-up care is essential in the patient's treatment. Be sure to go to all your appointments, have an understanding of the results of the tests and assessment done, and list of all your medication. It is also very important to notify your healthcare provider if you are experiencing any problems.
Care of incision. This may take 4 to 6 weeks to heal. Once the patient is home, they may shower daily. However, they should not use a sponge or washcloth on the incision, as those materials may be too rough. No powder, lotion, or ointment is to be used until incision is healed. If there is any redness, drainage, or breakage of skin in that area, the patient should visit the nearest health center. Rest and sleep. During initial recovery period, the body considers all activities as work. This means that the patient needs more rest during this time. They should plan or build rest periods into their day so that they don't get tired. Diet. Patients should maintain a heart-healthy, low-salt and low-fat diet. However, calories from food are important to heal the incision. Though it may take a while to regain an appetite, the patient could feel better eating smaller, more frequent meals rather than 3 big meals during the day. Medication. Medication should be carefully explained to the patient, such as the purpose and the effects. The nurse should also help the patient to establish a timetable of when to take the medication and also the side effects that comes with them.
Okay, so now for our care plan. Subjective data, the patient verbalized feeling tired and experiencing shortness of breath, chest pain with a rating of 7 out of 10 on the pain scale. Objective data, extra S3 and S4 hard sounds, that is murmurs, were auscultated over the pericardium. Tachycardia was also noted, grade 2 pitting edema to lower extremities, poor capillary refill in both extremities were also noted. ECG results displayed sinus rhythm tachycardia with premature ventricular contractions. Temperature 101 degrees Fahrenheit, pulse rate 120 beats per minute, respiration 25 breaths per minute, BP 92/68 millimeters per mercury, and SpO2 90%. Nursing diagnosis, decreased cardiac output related to decreased ventricular filling secondary to prolapsed mitral valve, as evidenced by reports of shortness of breath, tiredness, chest pain, 7 out of 10 on pain scale, BP of 92/68 millimeters per mercury, SpO2 90%, pulse rate of 120 beats per minute, respiratory rate of 25 breaths per minute, heart murmurs, edema, poor capillary refill in both extremities, and ECG results displaying sinus tachycardia with premature ventricular contraction.
Patient outcome. Short-term goal. After 5 hours of collaborative nursing care, the patient should be able to maintain a body temperature of 96 degrees Fahrenheit to 98.6 degrees Fahrenheit. Report absence or minimize occurrence of dyspnea and chest pain of less than 5 out of 10. Prompt capillary refill. Decreased tiredness, elevation of blood pressure within normal range of 120/80 millimeters of mercury. Increase oxygen saturation of 95 to 100%. Pulse rate of 60 to 100 beats per minute and respiratory rate of 12 to 16 breaths per minute. Long-term goals. After 6 weeks of collaborative nursing care, patients should maintain an adequate cardiac output and rhythm as evidenced by vital signs within acceptable limits, control dyspnea. There should be absence of edema and heart murmurs.
Nursing interventions and rationales. Number 1. Administer humidified oxygen therapy as prescribed. Administration of humidified oxygen will improve lung expansion, which promotes increased oxygen to the muscles of the heart, which will decrease the risk of the patient becoming hypoxic. The oxygen therapy is used to combat dyspnea resulting from inadequate maintenance of oxygen. Number 2. Monitor vital signs and respiratory status. Closely monitor for symptoms of heart failure and decreased cardiac output, such as decreased capillary refill, increased respiratory rate, and increased heart rate. A change in vital signs, especially respiratory rate and temperature, can indicate if there is an infection present. The pulse oximetry provides an indication as to the saturation of oxygen that is in the blood and indicates if the oxygen therapy being provided is adequate. Blood pressure is an indicator of the adequacy of the pharmacokinetics of ACE inhibitors and whether it is overworking or not. These are symptoms of heart failure progressing and cardiac output declining.
3. Monitor and maintain fluid intake within cardiac tolerance. The rationale: maintaining a fluid intake within cardiac tolerance helps to prevent overloading of the heart and prevent edema in the patient. The amount of fluid taken in should be adequate to keep the patient hydrated, but not enough to cause overload and increased workload on the heart and heart muscles. This will force the heart to work harder and faster while putting stress on the heart, which may cause further complications and increased fluid retention. 4. Reauscultate heart sounds. Note rate, rhythm, present and the presence of S3 and S4 heart sounds, and also adventitious breath sounds, and monitor electrocardiogram. Rationale: the new onset of gallop rhythm, tachycardia, and fine crackles in the lung bases can indicate onset of heart failure. If the patient develops pulmonary edema, there will be coarse crackles on inspiration and severe dyspnea. Electrocardiograms reveal if there are irregularities in rhythm and rate of heartbeat. It indicates if further intervention is required based on the readings. Low perfusion may result in cardiac dysrhythmias.
Nursing intervention 5. Ensure the patient remains on bed rest and is placed in a comfortable position that does not compromise cardiac output. Rationale: restriction of activities reduces unnecessary movements to facilitate recompensation and decrease workload and overexhaustion of the heart. Bed rest also promotes conservation of energy. Nursing intervention 6. Note for chest pain: identify location, severity, quality, duration, and associated manifestations such as nausea and precipitating and relieving factors. Rationale: chest pain is an indicator that there is an inadequate supply of blood to the heart, which can compromise cardiac output. Inadequate supply of blood can further cause heart complications.
Another nursing intervention: encourage patients to maintain good oral hygiene. Rationale: maintaining healthy oral hygiene will limit the number of bacteria moving to the heart and prevent endocarditis. The bacteria, streptococci and staphylococci, developed from poor hygiene, can translocate and become lodged in the new heart valve. This will result in endocarditis, which will damage the replaced mitral valve. The artificial heart valve provides an area for the bacteria to thrive and multiply whilst causing bacterial endocarditis. The final nursing intervention: administration of medication as ordered, such as analgesics, for example morphine, beta blockers such as propanol, antiarrhythmic such as digoxin, anticoagulants, for example heparin, and lastly diuretics such as Lasix. The rationale: morphine, which is an analgesic, would help minimize chest pain after valve replacement surgery, as they would feel wound and muscle pain around the chest area for a few weeks. Propanol or beta blockers: these drugs help prevent irregular heartbeats by making your heart beat more slowly, which reduces blood pressure. Beta blockers also help blood vessels relax and open to improve blood flow. Digoxin helps to restore a normal pumping rhythm to the heart. Heparin would be a prescribed blood thinner due to the mechanical valves being constructed of carbon and titanium, and your blood may tend to stick to the artificial valve. That can cause the valve to clog and malfunction. Secondly, an artificial valve can create turbulence in the blood flowing through your heart. The blood does not flow quite as smoothly as it does with a natural valve. This creates another opportunity for blood clots to form. Lastly, Lasix. This helped to reduce blood volume, which therefore decreases venous pressure, peripheral edema, and cardiac dilation.
Evaluation. Short-term evaluation. Goal met. After 5 hours of collaborating nursing care, patient maintained a body temperature of 97.8 degrees Fahrenheit, reported minimized occurrence of dyspnea, and chest pain of less than 5 out of 10. Capillary refill was prompt, and patient reported decrease in tiredness. There was an elevation of blood pressure to 125/82 millimeters of mercury, SpO2 of 96%, pulse rate of 82 beats per minute, and respiratory rate of 16 breaths per minute. Long-term evaluation. Goal met. After 6 weeks of collaborative nursing care, patient maintained an adequate increased cardiac output and controlled dyspnea. Heart murmurs and edema to lower extremities were absent.